Hello, in this video I will explain how to contour the Spex Back Support for wheelchair users presenting with kyphosis. People with a kyphosis can typically present as quite flexed in the torso and may experience pain and discomfort on the curve of the spine that contacts the support surface. The Spex Back Support can accommodate this curve whilst offloading pressure for these users by optimizing contact over the whole back. You may need to consider back support angle, hip and pelvis support, and tilt options for the wheelchair chassis, in addition to contouring the Spex Back Support. The first step is a good manual assessment of posture in the wheelchair user's existing chair and in sitting. This looks at where the person's back makes contact with the back support surface, any areas of pain, where there is postural correction possible, and what reinforcing support is necessary. We want maximum contact between the person's back and the Spex Back Support. This will optimize pressure distribution and comfort. We want to build up areas in the cell substrate pockets according to the assessment of the wheelchair user's postural needs. Sometimes it can be quicker to do a pre-assessment setup for a kyphotic posture like this. This accommodates the curve and helps with offloading and comfort. To make adjustments while the user is seated after initial configuration, you can remove the cell system, place a pillow behind their back to support them whilst you make further adjustments, and then replace the cell system back into the cover. Ensure that there is a good contact without areas of significant pressure between the user and the cushion, and ensure that there are no areas with no contact. Care must be taken to assess contact with the user and to ensure that contouring is in its correct place for the user's postural needs. Here are some tips on contouring. Instead of attempting to push the pads into the pockets, it is easier if you place the pads over the pockets and pull the material up and over the pads like this. Pads can be folded over or rolled for more direct support. The front foam layer will then flow over the contouring to ensure a smooth and comfortable interface. Pad sizes are designed to correspond to the super shape size selection. There will be different size pads and pockets for different back support sizes. Glide gloves or anti-shear gloves are effective to reduce shear when assessing posture with the wheelchair user seated against the back support system. Ensure clothing is pulled down and not gathered behind the user when assessing final support and positioning on the wheelchair back support. With practice, this can be completed very quickly during assessments and seating provision appointments. Have a look at our other videos for cover care and maintenance and contouring chart completion. Thanks for watching.